And we are live. We've got a lot of participants coming in the call. We've just jumped up to about 45 people. And as we have everybody coming in, welcome to the webinar. You're in the right place. We are going to allow a couple of minutes for people to come into the call. We've got over 100 people now. And we'll be kicking things off at about 12:05. Hi, everyone. To those who just joined, we're at about 150 participants right now. We're here for the live webinar for the Pulmonary Fibrosis and COVID-19 conversation. You're in the right place. We're just waiting for everybody to pile in because we've had a lot of people that have been in the queue. And we will be starting in just a couple of minutes. And my name is Kyle, and I'll be the moderator for today. Hi, everyone. Well, we've got some questions about if anybody can hear the audio, and we haven't put on any elevator music. We've just been waiting for people to come into the webinar. We've got about 171 participants. If anybody is worried that they're in the wrong place, look at the screen. You are in the right place. The Pulmonary Fibrosis COVID-19 live webinar. We've got about 175 participants right now. We'll be talking a little bit about how we're going to navigate the webinar in a couple of minutes. And we're just waiting for the rest of the participants to come in, giving people a little bit of time. But we will be kicking off in 2 minutes. This is great. So we've got just under 200 participants now. I'm just going to give a brief introduction for the next couple of minutes. My name's Kyle Brown. I'm going to be your webinar host for today. Very excited to be here with the Canadian Pulmonary Fibrosis Foundation. We've got some questions on if anyone can hear the audio. So if we can use the chat function within Zoom to give us a little bit of a sound check. Let us know how the audio is coming through for everyone, because we haven't been talking a lot in the beginning of the webinar. We've been waiting for some participants to come in, but now we will soon be starting. So we're getting a lot of good audio confirmation. That's great. So we do have some people saying that they're not, we do have one person saying that they're not getting any audio. And I will, I'm going to send a note to some people that we have in the team here so that we can follow up, with people. We did think that the chat was going to be visible to all participants. And that is something that we are looking at that is something that we're looking at opening up to everyone. Yes. So, all right. So if you would like, so you might find in your chat when you have an option in the bottom window that you can select yourself if you want to message just myself, just the panelists, or all panelists and attendees. That would be great. We are going to kick off now. We've got about 205 people on the line, which is very exciting. So once again, welcome to the Pulmonary Fibrosis COVID-19 webinar. We're very excited to get started today. My name is Kyle Brown, and I'm here today with a couple of people that we will introduce in just a moment. We're going to talk about the topics of managing pulmonary fibrosis during COVID-19, continuing care for pulmonary fibrosis, and staying connected during social distancing. We're aiming to have all of the panelist discussions over at 12:40 so that we have 20 minutes for a Q&A. And so you might notice that at the bottom of your screen, in addition to the chat panel that you can use to let us know if you have any audio issues or if you have anything else, any other difficulties accessing the live content, if you can use the Q&A function to enter any questions that you have to the panelists. We have some members of the team here that are going to be collecting those questions. Many people sent questions in advance of today. Thank you for those. We have talked to the panelists about those questions, and many are integrated into the content of what we're going to go through today. But that said, the reason for the live Q&A at about 12:40 is so that we can address any questions that we haven't had a chance to acknowledge. And so please do use the Q&A function. It should show up as a little chat window. There's an option for you to share your question anonymously if you'd like to do so. So if that's a factor for you, know that you can share your question anonymously, and we will not be sharing who is asking any of these questions. The questions will all be sent to like a central environment that the rest of the attendees will not be able to see, but we will share those. We will share those soon. So our panelists for today, very exciting. We have Dr. Marin Kolb here from McMaster University. He'll be speaking first, followed by Sarah Goodwin from St. Joseph's Healthcare Hamilton, and Sharon Lee. She is the Executive Director at the Canadian Pulmonary Fibrosis Foundation. So that's enough talking from me. Let's talk to the people that we came here to listen to, starting with Dr. Marin Kolb. And this is just a slide again on the what the Q&A environment looks like. That is just a button at the bottom of your screen. You'll notice that you are on mute. All attendees are on mute. So if you do have any questions, please send them in through the Q&A experience. All right, Dr. Kolb.
Good. So welcome everybody. It's great to see so much interest. And COVID-19 is indeed something that occupies probably 90% of our attention these days in the medical field. And we received a lot of questions prior to meeting formally now, and I will try to address as many as possible. A lot of good questions, of course, and some of the questions can be addressed better by Sarah, who is our fibrosis coordinator, and Sharon Lee from the CPFF. And so just a few words about COVID. I think you probably are already sick about hearing of COVID, and there is a lot of news out there. There is a lot of news means there's a lot of bad news as well. Bad means not really validated. And this is a big problem which confuses everyone. It confuses not only patients and caregivers like you, it confuses physicians as well, who are supposed to know a little bit more. Yeah? So there is a lot of stuff out there. And one of the advices that I can give you up front is don't believe everything you hear. Always question it. Yeah? So the time that we have right now to validate information, even in the medical literature, is just very sparse, and a lot of news outlets, and that is lay press, that is specialty press, those are scientific journals, really are forced by the time and do not always pay the same attention to reviewing material prior to being sent out. Yeah? So you are all friends of the CPFF, and Sharon and her team always make sure that information that's posted on our website is validated as well as we can. Now, what is COVID-19? As I said, you heard a lot about it. It's a viral disease. We don't have to think about where did it originate from, because it doesn't really matter for our problems right now. But it is a viral disease that enters the body typically through the nose and the throat. That's pretty much the same like most respiratory viruses enter our body. So they have little docking stations on the cells that line our nose and our throat. And they, in a way, hijack these docking stations to enter the cells. Once they're in there, they are stimulating a response of the body. Again, this is very normal. Any cold like disease, any flu-like disease would be felt by us as snotty nose, sore throat, headache, so a bit breathlessness, a bit cough. So this is all very unspecific. It's just a response that a virus entering our body that way would always trigger. Now, viruses are not all the same. So, and this COVID-19 causing virus, which is called a coronavirus, it is actually related to the SARS that we dealt with 20 years ago. That specific virus now induces a body response that is much more vicious. And if you hear that people compare it to the flu, the seasonal flu, this is not a bad comparison, but by all we know, it is worse than the seasonal flu. It is not as bad as the SARS that we had 20 years ago. It is worse than the SARS that we had 20 years ago because it is just more infective. Yeah, so bottom line is that this response that the body elicits after contact to the virus can lead to these very severe respiratory illnesses, and that would involve the lungs. So it starts in the nose and the throat, goes into the lungs. People may have heard the word cytokine storm. A cytokine storm is basically that response that the body elicits. And that can be very simple and easy, so people would feel not much or just having a little bit symptom. And it can be so severe that the lung does not cope with it. And when the lung does not cope with the problem, it basically opens the gates in a way, right? So the lungs are a barrier between our inside, the blood, and the outside, the air. And the job of that barrier is to get oxygen in, good gas, and carbon dioxide out, which is the bad gas. But just imagine that close proximity between the blood and the air space. If you open up that gate, you just get a big flooding. Yeah, if you have ever been in Venice, there are actually gates outside in the sea to prevent the flooding from entering the city, and that's where the lagoons come in. If you would open those gates, the whole city would drown. And if the lungs open the gates because of a virus like this one, it fills up with fluid, it fills up with other bloody components, and that makes breathing very hard. Now, a lot of you have pulmonary fibrosis or care for patients or relatives who have pulmonary fibrosis. In pulmonary fibrosis, that barrier between the blood and the air is thickened because of scar tissue. And that makes breathing so difficult for you. So in order to exchange the gas, you just have to work much harder. You have to wait longer for it to get exchanged, or you need supplemental oxygen to have enough of the good gas to move into the lungs, okay? Now, the combination of someone with existing pulmonary fibrosis and a possible severe viral illness like COVID-19, in theory, could cause havoc, right? And this is what I saw in a lot of the questions that you had. You think there's already a bad disease that you feel in everyday activities, and you hear about COVID-19, which is another bad disease. And of course, if you have both, you are afraid that this may not be anything that you could survive. This is a concern that anyone with a chronic lung condition would feel. It does not limit itself to pulmonary fibrosis. It's also including patients who have cystic fibrosis or who have emphysema, COPD. So this is a concern that anyone with a lung condition would have, because you already have mobilized inner reserves to deal with pulmonary fibrosis, and you may run out of these inner reserves when you have to deal with another problem. Now, one big question that came up a few times is whether patients like you or the patients you care for are at a higher risk to get COVID-19. And some have asked, were there any cases reported in the world or in Canada or in Ontario about patients who have both? There are cases reported. I have not heard any excessive numbers of such cases. So we have not seen yet any signal that would say that people with pulmonary fibrosis are particularly at risk. There seems to be a bit an increased risk of patients with COPD who have been smoking or are current smokers, because that might just produce more of these entry docking molecules that the virus uses to enter the cells. In pulmonary fibrosis, we have not seen anything yet. That does not mean you should not be cautious. I think it would just give you a little bit of reassurance that you are at higher risk because you already use your reserves that you need to breathe. So don't use, if you need extra reserves, you may run out of them. So you should try to avoid getting COVID. But it doesn't seem as if there is a real excess risk so far. Now, how do you avoid it? I think you avoid it by listening to serious news. The government news are often changing. They're changing not because they don't know what they're talking about. They're changing because, of course, every day we get new knowledge and we get new ideas and we get new pieces of information. When someone initially said you should not wear a mask in public, and now they say you should wear a mask in public, that is just because we learn as we go, and we have to change our mind if we look and hear to scientific developments and knowledge, right? So this is not that the government and the healthcare givers would not know what they're talking about. They just learn as we go, and just imagine this disease is not around for longer than 4 or 5 months. So it's very short time to really respond to it. Now, you probably talk to your doctor every year before the flu season starts about influenza. They will always advise you about getting the proper vaccines, influenza shot, pneumonia shot. They say if you have someone around who has a snotty nose, just stay away. None of that is really any different here. It may be a little bit more excessively portrayed, so you get it told much more often, and you get it maybe told much more rigorously, because it is a virus that is just more vicious than a seasonal flu. But the principles are really the same. One question that I addressed at last, because it came up a few times, was about the masks. Yeah? So whether wearing a mask in public, and my gut feeling would be that more and more governments will advise people to wear masks in public. Of course, that needs enough masks to be produced, which is underway. But would such a mask protect you from getting this disease, or would such a mask protect others if you have the disease and you don't have symptoms? So those are fundamentally different questions. By all we know is that the mask would reduce the likelihood of you, if you have the virus and you don't know it, spreading particles and aerosols and droplets into the public. So if you wear a mask, you go into a grocery store or wherever, it's less likely that you contaminate the surfaces that other people might touch. And this is how most of the transmission occurs. Yeah, so someone just coughs and it just like gets, I mean, our Prime Minister had said the moistly voice, right? And that basically is something where little droplets come out and they just fall on a doorknob. The next person opens the doorknob and scratches the nose. And this is how it's transmitted. Yeah? So if you have a mask, that would be reducing the droplets from people who are asymptomatic. A mask does not as safely protect you as you may think. And this is why at the beginning, the healthcare professionals said, well, don't wear a mask because it gives you a false sense of security, because you just don't know exactly how to put it on. And like everything, it needs training to put on things in a proper way. Because it is not even a doctor doesn't always do it right. Because you have to have a certain way on how to put on a mask. So if you wear it, you feel falsely protected, because most of the people would do it wrong. So I would not really bank on getting protected by going out with a mask, but I would have bigger hopes of people wearing a mask in the public, because it will reduce the spread. And you all probably agree that social distancing is doable for a good while, but ultimately it's not anything that humans like for long term. So we like to socialize, and in order to socialize in the future, we may have to get used to the idea that we have to do this for a certain while using a mask, not to protect ourselves directly, but to protect the others. And by protecting the others, we protect ourselves. Okay, so those are a few things that I just wanted to tell you that came up in the questions. I will hand over now to Sarah, and then afterwards to Sharon, and we have plenty of time to address your questions. So just write them in the Q&A box, write them in the chat window here, and Kyle and his team, they will keep track and make sure we address as many questions as we can.
Okay, so nice that there's so many people joining today. I'm Sarah Goodwin, work at St. Joseph's Healthcare as the ILD coordinator. And today I'm going to talk about how do we manage pulmonary fibrosis in today's climate of COVID-19. We'll review physical activity and pulmonary rehabilitation, mental health and well-being, and advice for caregivers and families. So we all know that exercise is important in pulmonary fibrosis or interstitial lung disease. It improves the cardiovascular conditioning and the ability of the muscles to use oxygen. It may decrease symptoms such as shortness of breath on exertion, and it helps breathing muscles be more efficient. And although exercise can't improve lung function, it does help with overall quality of life. So how do we manage physical activity? We can go to the next one, Kyle. The biggest thing to remember is to do as much as you're safely able to do. So we know that there's some things we can do when we're in social isolation. Purposely walk around your home or neighborhood if it's safe to do so. Challenge yourself to move each hour, even if it's walking in place or simple stretching. We're all at home right now. We've got lots of time on our hands. Try to create your own exercise regime, or search for examples on the internet or on television or virtual public libraries to try and come up with some goals or some things that you can do safely at home. Be unique and try to use everyday items that you have around the house to help with your fitness goals. So now isn't the time to try and set unrealistic goals, but to try and set some manageable ones that you'll be able to continue. There are many resources out there to tap into. If you were part of a pulmonary rehab program before, it could be that that pulmonary rehab program is continuing on with virtual care. So reach out to them if you're part of a program like that. And then I've listed some resources here. So the UHN, or University Health Network in Toronto, has a pulmonary rehabilitation video that's on YouTube. that was done a few years ago by Dr. Ken Chapman and Marin Kolb. And it's a really good video on exercise and breathing for people that were in their pulmonary rehab program. So they actually taped one of their program sessions, and the video is available for you to view. Other things that I was able to find online are things like Nurse Next Door. They have some online videos for safe and easy exercises for seniors. And then there's some patient education resources through St. Joseph's. So if you log on to the St. Joe's website here in Hamilton, you can access the patient education materials from our respiratory rehab handouts. And the CPFF also has on their website some rehab and exercises that you can follow. So moving on to mental health and well-being, we know this is a challenging and stressful time for everyone. COVID-19 has increased anxiety and depression throughout the world, but especially to our most vulnerable people. So some tips to reduce stress and anxiety while we're all self-isolating. Try to limit your news. So set a regime to check in, whether it's once or twice a day. Pick a credible news source that you feel comfortable with. And that way you're able to know what's going on in the world and kind of check in without being overwhelmed by having the news channel on 24/7 and having people talk about this all the time. Take some time to unplug from social media, seek credible information, so follow the WHO or Health Canada or provincial and regional news sources. Try to create a routine. So if you get up at a certain time each day and get dressed and get ready, continue to do that. Try and keep things as similar to what it was before as possible without having to actually go out and leave your home. This gives a little bit of normalcy throughout this whole time. Try to talk about topics other than the pandemic. So when you check in with people, try and have something else to talk about rather than just COVID, so it doesn't become kind of the only thing that people are focused on. You can check out your virtual libraries, look for new hobbies, reconnect with friends. Try to be self-compassionate though. Everyone is anxious and worried, and cut yourself some slack. We know it's difficult. And everybody's feeling the same way, but we want to make sure that we're checking in with everyone and we're giving the support that's needed. And then also schedule some times for meditation or mindfulness. So have some times that you can kind of reconnect, or time you can set aside for reflection, and this is all important for self-care. So some resources that we have. We've listed them here, but also remember that anxiety and fear is normal. It helps to motivate us to take action, but it all needs to be kept in perspective. So there's some resources like the Daily Calm. So there's videos on YouTube. You can also download the app, and there's some meditation and relaxation videos. The Center for Addiction and Mental Health has actually updated their website with a section for mental health during COVID. And it's got some good resources for coping for anyone, whether or not you have an underlying mental health condition or are just trying to struggle through the new reality that we have today. And use the mindfulness link is using mindfulness for relaxation. And this link is actually about a 3-minute cartoon video just to explain what mindfulness is. It's a new term that people have been throwing around for the last few years. And it's really just learning to live in the moment and to refocus your brain to kind of be in the moment and be able to relax and kind of reduce the stress that we all have sometimes. So some advice for caregivers and families. So this can be a difficult time for everyone. And the role that caregivers have, it can make you feel lonely, and the stress of the pandemic can even make it worse. So we want you to know that you should focus on what you can control. And seek some ways to care for your loved ones, such as seek reliable information, have a contingency plan. So know who to contact and how your care provider is providing that health care right now during the pandemic. Most of the care providers right now are providing virtual telephone care, but people are still working and we're still here for you. So we want you to know that when you're having a difficult time or a difficult day, to reach out to your care providers. So look for positive stories in all this. There can be a lot of negativity, but look for those things that can lighten the day a little bit. Stick to your routines. connect with supports through social media, and have a backup plan in case you become unwell. So the worry is if someone, if you're taking care of someone and you get sick, kind of have a bit of a backup plan on what you could do or who you could call on if you were the one to become unwell. Okay. So take time for yourself. Try different things, reading, crafts, hobbies, quiet time. You need that alone time to recharge. Right now, we're all kind of together, stuck at home, and whether we're alone or with family members, it can be difficult. Remember to tend to your own feelings and needs, and give yourself that space for a little bit of alone time to recharge. Stay connected with family members while following guidelines, so virtual visits, letter writing, reach out by telephone, those things that we've kind of gotten away from when we're all really busy, maybe try to touch base with them again. And seek virtual support groups for caregivers. So if you're feeling overwhelmed or you're feeling stressed, there's a few resources out there. The Ontario Caregiver Organization has a helpline. There's also on their website some peer-to-peer support, as well as virtual caregiver support groups. And if you're listening today from across Canada, Caregivers Nova Scotia, Family Caregivers of British Columbia, and Caregivers Alberta have similar programs set up on their websites. And finally, look for the inspiration and the joy in the small things. So something as simple as if you're able to take a walk and get out, if that's safe for you to do so, there's messages all over the place that kind of give some inspiration to people and allow them to feel a little more connected to each other, even though we're all staying apart. And I think Sharon's going to take over and talk about the CPFF.
Thank you, Sarah. Hello, everyone. My name is Sharon Lee, and I'm the Executive Director of the Canadian Pulmonary Fibrosis Foundation. Thank you for attending today, and thank you to Hoffman La Roche Canada for supporting this webinar today, and Dr. Kolb and Sarah for sharing their great information. I just want to say that we obviously have lots of resources on our website. If you go to www.cpff.ca, we try to post all the legitimate, very good, knowledgeable links for everyone to access, whether it's exercise or mental health care. If you subscribe to our newsletter this month in April, you would have received our newsletter that told you all the links were to get really good information on what's happening with COVID-19. As Dr. Kolb has stated, it changes minute by minute. So those websites are really good resources. They're the Canada Health website, the provincial health website. They try to keep up and tell you what's happening in your province. So I highly recommend everyone to check out those links for yourself if you have some questions and thoughts. The other thing is that there's a question about Zoom, using Zoom to connect with CPFF. CPFF have received a lot of these suggestions, and we are looking at ways of how we can maybe create a virtual coffee club so that we can just come together for half an hour, maybe once a day, just to check in with each other and see how people are doing across the country, just keeping connected that way socially. We have lots of support group across Canada. We have 20 of them right now, and they're all listed on our website, so you can call them and connect with them. And we're also trying to help each of them to set up a Zoom site so that they can utilize that to meet and connect as well. So we're also doing virtual group meetings. And as always, I always say that, you know what, send us your questions, whether on our Facebook at Canadian Pulmonary Fibrosis Foundation, or go to our website, sign up for a newsletter, check out the links that we have up there, or you can always simply also email myself as well, Sharon at cpff.ca, in case you have things that you would like to ask. We try very hard to answer everyone, but obviously there are times when we have to check with the experts, because at CPFF we pride ourselves on always making sure that our facts are correct and that our medical health professionals like Dr. Kolb have reviewed them and said, yes, that's good information, because we never want to give anything that has not been validated or it's incorrect. And as I said, during this social distancing, CPFF is trying to seek lots of ways to help us. We're trying out a trivia game. We're trying to set that up. I haven't done it very well, so I apologize. But we're trying other things to keep it fun. And like I said, there's been a suggestion about how about if we have a coffee club once a day for everyone across the country just to log on and say hello. So that's one of the things that we're trying to see how we can do and set up. So thank you very much.
All right. Well, thank you to our panelists. That's Dr. Marin Kolb, Sarah, and Sharon Lee. Now we're going to go into a Q&A portion of the discussion, a little time check. We're actually running ahead of schedule. We thought that we would have 20 minutes, and it looks like we've got more than that amount of time. Thank you for entering your questions in the Q&A function in Zoom. If you joined the call after we started, we've been collecting questions using the Q&A function, and you can just scroll over top of your video to get the menu that you need to enter that Q&A and answer your question. So we've got a couple of questions for Dr. Kolb. The first is, what is the difference?
Kyle, I have a few that I have tracked here as well.
Yes, and we've got them in our list.
Yeah,
so would you like to start with the ones that
I think are important for folks to know? Yeah, and then we'll keep track for what I answered already. Okay.
Great, sure thing.
So one important question that people had was about testing, right? So some of you might need to go to blood tests, particularly if you're on drugs. It could be pirfenidone, could be nintedanib, could be other drugs that warrant monthly or bi-monthly blood testing, and of course the breathing tests. So for the breathing tests, as you know, the continuation of drug coverage by the government is contingent on us submitting a breathing test. And the patients who know Sarah know that she always is adamant about getting the breathing test done, right? Otherwise, the government will stop paying and funding the medicine. And others who don't see Sarah, but other professionals, they will hear the same. So the governments have for now waived the need for doing breathing tests to continue drug coverage. So that's a worry that you don't have to have. Yeah. So missing that breathing test that Sarah and the likes of Sarah have said is so crucial is for the next couple of months not an issue. Government say, well, don't go to the hospital for the breathing test. If, however, your doctor tells you I must have a breathing test to make a decision that's important for you, then you should not be worried about it, because the hospitals have all made proper precautions to get patients in a very safe way. Yes, we have reduced the traffic to hospitals, including unnecessary or not life important visits. Yeah, so they are done for a while now through virtual visits. But if you have to go in there, it's done as safe as you can, so don't be worried. And the same applies to blood tests. So for my patients that I usually say you should go monthly or every other month, I said, well, if the numbers were fine, it's okay to skip one test. Yeah, so just come a month later or 2 months later. If I see someone needs a blood test because there were some abnormalities, I will specifically tell that patient that. And the blood labs, as far as I have seen, all do the same precaution. So it's not dangerous to go there. You should ask your doctor, can it be skipped? In many situations, it can be skipped. Okay, I think that was an important set of questions that a few people had. There was also another practical question was someone asked about online shopping. Yeah, so a lot of us do online shopping. If you want to buy stocks these days, buy Amazon. Of course, online stores are booming now, and this is how a lot of people would do shopping. And that question goes back to how long does the coronavirus survive on an inert surface like a parcel or an envelope? and it doesn't survive very long. It is believed that after 24 hours, all the virus that would have been on there, possibly because of the mailman touching the envelope, for instance, should be dead. Of course, should be means we don't know for 100% sure, right? So what is often advised is if you do online shopping, just open the box, throw the contents out. The contents are not touched for a good while, at least for 72 hours, even if you get rush delivery. Don't touch the contents, discard the box the usual way. Go wash your hands, has to be 30 seconds, warm water, lots of soap, and then you can safely enjoy whatever you purchased, okay? So I think those are just a few practical things that people had. Some questions were coming from patients who have undergone lung transplantation. And of course, if you have a new lung, you are on medicines that suppress your immune system. And you're always told by your doctor that you should try to avoid infections. That's easy said, not necessarily easily done. But by doing some of the precautions that we talked about earlier, you reduce the risk of getting infections. What about the immunosuppressive drugs that you take? So do they make you more prone to get infections? That is true for most infections. And often we say reduce the drugs in case you have an infection for a short period of time. Never do that on your own. Always ask your doctor if this is a question that comes up. So far, we have not seen that lung transplant patients are at particular risk to get more COVID-19. Of course, that could be just because those individuals are cautious anyway. They know how to avoid it. They know how to do social distancing. They know better how to wear a mask. So it may just be that they don't get it because they know exactly what to do to avoid it. In theory, it could also be that the immunosuppressive drugs that these folks take are preventing that cytokine storm that I said before. Because what really is a component of the very bad COVID disease is that the bodily response, I said that at the beginning, is just excessive. And the immune system, when it's suppressed, it may not raise that response. But this is a theory. We don't know. Yeah, but bottom line is the advice is to anyone who is has a lung transplant or takes other immunosuppressive medicines, just try and stay away from infections just the way how you would be advised anyway, if it's COVID related or not. Okay. Yeah, so those were a few questions that came up from patients with lung transplants. Kyle, I think I give you now the microphone back just to coordinate the other questions because I haven't tracked what came in right now.
Great, we did have some questions from earlier, so we'll kick those off. One question is, what is the difference between fibrosis scarring caused by pulmonary fibrosis compared to scarring from COVID-19?
I saw that question. That's actually a very good one. So whoever asked that question has read a lot about pulmonary fibrosis. Now, you will remember at the beginning I said there's a lot of information out there that's not validated. And honestly, no one can have pulmonary fibrosis the way we talk about it after a short course of 4 months. And that's as long as it goes back to have the first COVID patient. So this is way too early. So if there are reports saying people get pulmonary fibrosis similar to IPF from COVID, this is just not true. It's a possibility, yes, but we need much more time to really ask that question. What we have seen is that some patients post-COVID have a bit of prolonged time to recover with their breathing function. So if you do a breathing test in patients post-COVID, let's say a month after they recovered and left the ICU, that breathing test could be showing abnormalities just the same way as a patient with IPF. So the lungs get smaller, you cannot take as much air in. That's the FVC, so the forced vital capacity. And the lungs have lesser ability to get oxygen into the bloodstream, which is called the diffusing capacity. That may be down. So those numbers are affected and reduced in patients with IPF, and they can be affected and reduced in patients post-COVID. Whether this is persistent and leads to pulmonary fibrosis or not is an open question. It's a very good question, but there is no evidence whatsoever out there to date that would confirm that. We are doing studies. Yeah, so as we have the CPFF, we have a very well organized group of fibrosis clinics in Canada, and we are going to follow patients post-COVID, particularly the ones that were severely ill and on breathing machines. Yeah, we are planning to follow them over time, let's say 3 months after discharge, 6 months and 1 year. And then at some point we will be able to answer that question, whether people can get a disease like IPF or whether this is just a transient and prolonged recovery.
Dr. Kolb, you said that you hadn't seen our questions, but you actually just answered the second one. You led right into it. People were wondering if COVID survivors were at an increased risk of developing IPF, and you've indicated that it's too early to tell, but that the medical community will be monitoring that. Just one acknowledgement to the people that are on the line. We are recording this session, and so if you're worried that you've missed anything at all, please don't be. A version of this recording will be made available. We do have some additional questions, and we've got time to get to them. The next one is, am I okay? You referenced, Dr. Kolb, that you know, how to manage online shopping. Some people are wondering if it's okay to get blood work done during this time, if it's okay to go to scheduled medical appointments if they are necessary. You did reference that they don't have to be afraid to not go, that they wouldn't have any interruptions in medication, but should they be afraid to go if they have to?
Well, you know, they should go if their doctor says they should, right? So for the time being, we're okay with doing the online visits. Now, virtual visits are not always easy. Right? In my hospital, we use an electronic system to keep our medical records, and we can do visits through the system very safely, very securely. No one can hijack it or hack in. But you have to be a little bit tech savvy, right? So it's not always as easy as we think for the user, the patient, and we know that a lot of patients with IPF are not the youngest. Yeah? So sometimes it's more difficult than we believe. And a video visit allows me and Sarah to visually see how someone is doing, how their body language is, how their mimics are, right? Because this is all information you would not get by a phone visit. For some time, we can get along with these virtual visits to help manage you, but eventually we are also assessing a patient by just sitting across and getting information from more than what they say and what they speak. Yeah. So at some point, or for some patients, your doctor may advise you, I really need to see you to make a proper judgment about what's best to be done for you. And if that's the case, you should be trusting that your doctor will keep all precautions to make it safe. And if they say you should come, then you should come. If not, you should trust them that they will do the best.
If I can add, Kyle, just about the blood work, if people are concerned about going to a lab, and I have to say the labs have been handling this very well. You can book an appointment online, and they're limiting how many people can go in. The people that are there drawing the blood, the techs, they're fully gowned and gloved and masked. So they're doing a really good job in controlling. It's probably safer than going to the grocery store to have your blood work done. But if you're still concerned about that, there are some ways that home visits can be done. I know Life Labs offers this service, but it does have to be set up by your doctor. So if you're interested in that, there is a cost to it to you, but you can contact your doctor's office and they can set that up on a one-off if you really need to have your blood drawn for monitoring and you really don't want to go out.
We have thank you both for that. We have another question here. It is about, we're wondering about the state of respirators and the availability of respirators, and if IPF patients are allowed to have them, or if there are shortages.
Okay, this is a delicate question. Now, first of all, for the time being, we, I think, did luckily not get as hard hit as some other countries. So the healthcare system was preparing well enough. You have heard from particularly Italy and Spain and France, where the surge of patients was so high that it quickly overwhelmed the healthcare system. We know that the Canadian healthcare system is a very robust one, but it is not necessarily a system that is super resourceful if there is a major catastrophe, but you may tell it luck or you may tell it good planning, but so far our capacity has not really been overwhelmed. So here in my institution, we have always had enough ventilators and breathing machines to provide care for anyone who would need that support. Now, the question whether a patient with IPF should be on a ventilator if he or she contracts this disease is exactly the same that you would discuss it if it would not be COVID-19. So if you get ill with a severe influenza or a severe pneumonia, a lot of your doctors would say, well, with this complication, you are at risk to get a flare of fibrosis, and putting you on a breathing machine has a very low chance of getting off the breathing machine. That can, of course, vary between the illness that you deal with, between other factors like comorbidities. Do you have other diseases that your body has to deal with or not? But in principle, we want to avoid as good as we can to put anyone with pulmonary fibrosis on a breathing machine. The more advanced your disease is, the less likely it will be that you will survive being put on a breathing machine. And at a certain stage of your disease severity, you should always have that discussion with your doctor. Ideally, your doctor raises it, or your fibrosis coordinator like Sarah raises it, just to give you an idea and to let us know what you want to be done if it came to that position. Yeah, just to get the proper information. Yeah, but so far there has not been any need to be triaging patients. Yes, if you are listening to the news, that was something that has been a horrible situation in Italy, where they basically had one breathing machine and 3 patients who would have needed them. And that caused a lot of distress to patients, to the people, and to the doctors, because what would you base a decision on who gets it and who doesn't get it, right? But luckily, as I said, in Canada so far, we have not had any bottleneck here about breathing machines being not available.
Kyle, if I could jump in, I saw a couple of questions. I thought maybe I answered this for the resources on CPFF website. So CPFF is going to develop 3 new videos, one on nutrition for those who have IPF and PF, and one on home exercise, and the third one is about managing stress. All of this sort of to help people to cope with COVID-19. So they should probably be finished probably by the end of this month, and we should have it on our website. So, you know, do come back and check at cpff.ca.
All right, so resources will be made available on the website for say, we did have one person from Thunder Bay that mentioned that there are no support groups out there, so that would be helpful for that person. Is that right, Sharon? Are there other resources that would be available
for our
to them?
virtual, and we're going to like I said, we're going to create a virtual group, and so that way, people can come and gather together.
Oh, it sounds great. And more information about that will be available on the CPFF website later in the month?
Yeah.
Great.
Well.
Another question for Dr. Kolb: how does a person with IPF determine if they have COVID-19? And are IPF patients triaged at the hospital with COVID-19?
The symptoms are unspecific enough to allow the clear distinguishing influenza, for instance, from COVID. So that could be pretty much the same. The chronic symptoms of IPF would be different because they don't come with headaches, they don't come with muscle aches, they don't come with fever. So what would be a challenge would be how to distinguish a flare of IPF, which we call acute exacerbation, from COVID-19. That could be a little bit more tricky, particularly if you don't have fever or headaches, because a flare of IPF could be more breathless, more cough, and feeling more tired. If that would be the case, we would do as if this patient has COVID-19. Just, we always assume the worst, and that's what probably most of you do. Luckily, it rarely is the worst. Mostly it's the easier end. But we just assume you may have it, so we took proper precautions. You're isolated. The healthcare staff is getting gowned up to be properly protected. You get tested, you get a swab on your nose, deep in the throat, which is not pleasant but not painful. But that will be tested for the virus. That is usually coming back between 6 and 24 hours. If the suspicion level is a little bit higher, we would not settle with one test. We would then get a sputum, so basically the phlegm that you cough up, and test that as well before we say this is clear. If everything is clear and you still have these symptoms, then we might say this is an acute flare of pulmonary fibrosis, and we would treat it accordingly.
All right, a quick question for Sarah. Some questions about the effectiveness of home breathing exercises for some people that are early in their IPF journey. People are wondering how helpful they are.
I think anything you can do to help your breathing and help build those accessory muscles of breathing is helpful. So breathing exercises do a few things. They help to reduce our stress and anxiety, which especially during this time can be a lot to be managing. But they also help to kind of build those accessory muscles of breathing. And I think they're always useful. I mean, if we look at different types of exercise that people, without lung disease do, things like yoga and Pilates and meditation type things, those things are always very beneficial in more ways than just the physical exercise. So I think it's important to do everything that you can do to help yourself in all means.
All right, one last question before we wrap up. It's for Dr. Kolb, and it's a sensitive one that's on many people's minds. If I've been in a house for over a month, and so have my grandchildren, would it be safe to have a visit with them?
Well, it depends on the grandchildren, right? Because if you are in your house and you control all the factors, you know that you are as safe as you can be. You have no disease. You don't know how the grandchildren behave. And grandchildren are grandchildren. They may not listen to the news as much as we are, and they just do what kids do. And that doesn't include wearing a mask. That doesn't include not touching the face. Yes, they will just pick their nose, and you can tell them 5,000 times and they will pick them 5,000 times, right? So, you know, just use common sense. You can't, life is not a bio bubble, right? So we cannot prevent everything. We can, we have as a population, as a people, a lot of things that we can do, and that will result in data that we call epidemiology data. So everything, every number development, every flattening of the curve, this is epidemiology. This is statistics. This is very important to make decisions, to give advice. What each individual does to themselves might be very different. But of course, the sum of all individuals doing things, that leads to the epidemiology. Yeah? So whether you see your grandchild or not, the chances that this is a problem are low. If everyone sees their grandchild, the sum of the problems is getting big. So I think you can't really, there's no guarantee in life. I mean, people say there's two things that are certain in life. It's death and taxes. And what I think each of us have to do is just make sure we behave in a way that does not put others in danger. And that's the key. If you want to see your grandchildren, I would say for the time being, see them from the distance, stay away, don't hug them, avoid their snotty noses. That's what little kids have. I know it for sure because Sarah's little kids have snotty noses, and sometimes she cannot come to work because she has a snotty nose, and this is what you want to avoid. Okay, so but I think there's no easy answer to these questions. Yeah, but I think overall, and there was another question that was in there, we have not seen the worst yet. I believe what we have seen is that if people do what they are advised to do, we can affect things in a very positive way. COVID-19 will not go away in a month or two. I don't think we will have a resuming of the NHL or NBA season very quickly with spectators. We may well have to get used that in the fall, in the next season, people in the stadium will have masks. Yeah, so anyone who has a good business idea should just make masks with a Maple Leafs or Calgary Flames logo or whatsoever. Yeah, I think that's something that we may have to expect. We don't know, because the time limiting factor is when will a vaccine be available and how efficient will a vaccine be. Yeah, and that is something that typically takes anything between, at the good end, 6 months, at the bad end, 2 years. Yeah, so it can be a while that we will have to deal with this, but we are learning well, and we are not over everything yet. But I think that's how I feel it. Yeah. And the very last that because that's just always what irritates me. So I think that the patient from Thunder Bay didn't only say there is a lack of support groups up there, but someone says I'm a dead man walking when I contract COVID. Yeah, and another person says I'm doomed. That's what my doctor told me. I don't like these dark scenarios. Yeah, so there's always stuff one can do, and there's nothing better for a patient with a chronic condition like pulmonary fibrosis to avoid getting additional problems. So just don't get them. If you can, do whatever we said. If you get them, just go to the people who can help you, and don't think you're doomed. And I don't think that any doctor should say such a harsh word. Yeah, just make sure you do what you're told to do, and that's not different this year and next year and the year before this year, because it is the advice that we always give patients with IPF in the beginning of flu season. Get your vaccines. Don't change anything. If you're on a puffer, keep taking the puffer. There's no reason to make anything what you do any different except the social distancing, and try to avoid getting infections.
Well, that is a great place to close our Q&A. A really big thank you to our panelists, Dr. Marin Kolb, Sharon Lee, and Sarah Goodwin. And thank you from the Canadian Pulmonary Fibrosis Foundation. We've got some links to resources here. I believe that this presentation, in fact, you know what? I'm going to give it over to Sharon, because Sharon is going to be able to tell us more about the updates coming to the CPFF website, where people will be able to find the presentation, and other links that have been shared throughout.
Yeah, so once this presentation is done and we've edited a little bit just to make it fit the time slot, it's going to be on our website. Like I said, our website is www.cpff.ca, and we'll post it and notify everyone on Facebook at Canadian Pulmonary Fibrosis Foundation, and you'll get that if you go there, or follow us on Twitter, CPFF Twitter at the CPFF. And also too, if you sign up for our newsletter, we'll have that information to you as well. And if you go to our website, the sign up is at the very bottom, and you will always get great information, and we'll let you know when the next webinar is going to happen, or when we're going to have our coffee chat via Zoom. And if questions and things that you want to know, we're going to write about it and send you those great links. So thank you.
All right, we had 275 people at the peak of this discussion, and up until about 2 minutes ago, most of them had stayed throughout the entire experience. So thank you everybody for attending. We've actually still got 185 people that are in the webinar, and so it looks like this has been a useful resource for a lot of people. So thank you again to the panelists.
Stay safe, guys.
Thank you.
Thank you.